Well, thank you all for being here. This is our last work group meeting for the Community Health Needs Assessment, which is due the end of this year. Counties and hospitals have to submit at the end of this year. And what we're going to go over today is the final results from the qualitative analysis that when we interviewed community-based organization leaders, we had some preliminary results on closed-ended questions that we presented the last time we met, and had to finish up some work to do the qualitative analysis for the coding for the interviews that we conducted. So that's what we're going to talk about today. So let's just see if I can get this to move. There we are. So if you could please just jot your name in the chat box, what organization you're from, we'd appreciate that. And that is also how we will be taking attendance. So I'll give everybody a couple of minutes to do that. Dr. Piggott, I see you're here, so I'm hoping that you're going to serenade us at some point. What do you think?
Is that a little secret there? What are you letting them in on there, Janine?
Yeah, well, you missed it. There was one meeting. We have the Community Health Assessment Survey, so its acronym is CHAS. So I took the liberty of taking all that jazz lyrics and changing it to all that Chaz. And I don't have as good a voice as you, but I thought I'd, gave everybody a little bit of entertainment. But no, I'm just, you don't have to. You're very talented, and just reminded because I had seen your rendition of Luck Be a Lady Tonight the other day. I saw it. Okay, so everybody's got put their names in. So here's our agenda, what we're going to go through. It is not going to be a full 2 hours unless we have a very wonderful discussion, then it will be 2 hours. We did our welcome, our introductions, our timeline. We're going to go over that, the priorities that were selected, some resources that you're probably already aware of, but just came across my desk a week or so ago. The results from the Community Health Assessment Survey, the data that's that individual survey. And then the highlight is the CBO, the Community-Based Organization Key Informant Interview Qualitative Analysis presentation. And then we'll have a discussion after that. So here we are on our timeline. We started way back. We started actually way back in September, so this is an updated timeline. And we did the community-based organization interviews between, I think it was the end of February and till the middle of March, if I'm correct. And that was piggybacked on the community-based organization surveys that we sent out to community-based organization leaders. So we're on track. As I said, we did select the priorities based upon the data we already had at our last month's meeting. And this is just additional information that'll give you the results from the qualitative analysis of those interviews. Okay. And the two selected priorities, you'll recall, were prevent chronic disease and promote well-being and prevent mental and substance use disorders. And those are the same priorities that we had for the last 3-year cycle and for the previous 3-year cycle. And I'm going to say even for the previous 3-year cycle to that. So why do we keep having the same priorities pop up? Well, that's because these are the areas in which there's the greatest need, right? We know, and Dr. Piggott knows this, right? Chronic disease, extremely prevalent, right? So it's the main driver of healthcare costs. And of course, the issue of mental health and substance misuse, we know, is just becoming a worse and worse problem. So these are some of the resources that I came across. You might have also come across them. In addition to what's on the prevention agenda, there's the county health indicator reports by race and ethnicity, leading cause of death, some stats on that. You can see the other data that's there. And then, of course, there's county health rankings you can go to for secondary data. That's a great source for information. The CDC has its the NHANES, right? The nutrition study. We've got BRFIS data that you can access via the state, that you can look at county level data, and that's behavioral risk factor surveillance study. And you can look at what some of the indicators are in terms of driving that chronic disease, how well are, or how people are behaving or not behaving well in terms of their diet and their exercise, activity levels, smoking, and a variety of other indicators. But I'm not telling you anything you all don't already know, but just to remind you, all of that's there to get a picture, which we can add to the primary data that we've collected through the Community Health Assessment Survey, through the CBO survey, and now through the qualitative key informants interviews that we conducted, and then the analysis that has resulted from that. So all of that taken together gives us a picture of what is happening here in our communities. Our CHAS data is available on our website. It is down to the zip code level. You can use, right, Brooke, this is pivot table driven, if I'm correct, or am I getting confused with Sparks?
Nope, you're right.
Right. Okay, so you can go in there, and if you want, I can click on it. We can take a quick look. If it opens. Okay. We can take a quick look at the 2021 analysis. So we'll go down there, and I got to kind of scroll down to find it. It says 2021 Community Health Assessment Survey results. I'll just open that in a second. Is it opening for everyone?
Janine, I'm not seeing the website. I'm still just seeing the slide.
I think I'm gonna have to, let's see. All right, I don't know why it's, let's see. Hold on a second. Not seeing it?
No.
Okay, because it opens up on a different screen, and I don't know why. Yeah, I can't hit, oh, there it is. Can you see it now?
Yes.
Okay. All right, so when we look at this, so it's got Nassau, Suffolk. You look at the tabs on the bottom are the different questions, right? So this is one of the biggest ongoing health concerns in the community where you live, and you can see we've got it by zip code, and you can then filter by the, you know, make your own reports. If you can filter it by gender or the county, also by these filters on this side: income, employment, type of employment, educational status, et cetera, race, ethnicity. And it asks, you know, goes so on and so forth for each question. So that was asked about what you see are the needs for your community. The next one is what you see are the needs for yourself, your concerns for yourself. So oftentimes we see a difference between what people perceive are the community needs and what people perceive are their own needs. There's sometimes a disconnect there. Not a big one, but we do see that. What prevents you and your family from getting medical treatment? Oftentimes, you know, and I think it's also in this survey report, correct me if I'm wrong, Brooke, but I think inability to pay still came up, right? I think was, if I recall correctly, which
I believe we added that as a new
a
option.
new option, but it in the past it had been like no insurance, which was kind of mind-boggling to us because we know we have pretty robust insurance coverage here in Nassau and Suffolk County. So we asked a new question so that we could get at the nitty-gritty of that. I think people might have insurance, but it's not the best insurance, and therefore maybe they had a high deductible and they couldn't afford the deductible. So in their minds, they couldn't afford to get care. So we broke that down and asked an insurance question, which we analyzed for the first time. this year. And 4 asks, what's most needed to improve the health of your community? Again, that's asking what you see as a need for your community, not for yourself. And then health information screenings. So this helps with planning for CBOs and hospitals in the county to know what do people need, what are they looking for. And then, of course, we ask where you get your health information. And I think this survey this time around said the health profession, and I think internet came at number 2, whereas I think it was flip-flopped the last time around.
Mm-hmm.
We asked a question about whether or not people had affordable, reliable internet. And these are the responses to that. And I think overall that we saw that there is good access to internet across Long Island. You can look at the numbers here, count of respondents, the average age, etc. Some areas, and I think we have a pie chart on this as well. We can take a look at that. And then we ranked everything, right? And these are the top concerns. Cancer came out at number 1 for Nassau County, for concerns for the community, but concerns for the person, yourself, it was heart disease and stroke. And in Suffolk, cancer was at the top for both, and so on and so forth. But so that's available on our website. You can manipulate the difference. You can slice it and pull out the information in any way you want and create your own reports. So I'm going to close this. Okay. And we're back to the presentation. So that's available there. We're always here to answer any questions, to help you maneuver through the data. It gets confusing even for us sometimes, but we're a little bit more familiar with it than most people are, so we're always here to help you out with that. So that brings us to our next slide. And I would like to introduce, we had an intern or practicum student from Stony Brook University's Masters in Public Health program who worked with us to analyze the interviews that were recorded and transcribed. And his name is Michael Pape. He's an MPH student, as I said, from Stony Brook University. He is also a chemist with the Suffolk County Water Authority, which intrigues me, and I never really got a chance to talk to him a little bit more about that, but thinking back to my days of chemistry, I was always interested in chemistry, and in fact, almost went to college for chemistry, but don't ask me how I ended up in communications. It was one or the other, and they're so completely different. I don't know how that came to be, but I probably wouldn't have done so well in chemistry anyway, but it's very fascinating. Science is fascinating to me. But anyway, so he's a chemist, and he's going to take us through the analysis that he did of the key informant interviews, the process that he used and whatnot. So do I have to stop sharing? No, he's going to work from our screen, right, Brooke?
Yes, Michael's slides are integrated into
Okay,
our
Michael's slides are here.
presentation.
Okay, so Michael, are you there? Are you ready
Yep.
to go?
The
Yes,
screen all good? Sorry, yes.
yes.
All right, great.
So I'm going to advance the slides for you. So you tell me when you need them advanced, okay?
Sure.
Okay. All right, so take it away, Michael Pape.
Thank you. It's a community-based organization, key informant interview, qualitative analysis presentation, and I'm an MPA student at Stony Brook University. All right, this is the introduction and background. The Long Island Health Collaborative, Nassau and Suffolk County Health Departments, and Long Island hospitals are conducting a community health needs assessment, and the key informants, several key informants from community-based organizations across Long Island had answered a previous health needs survey and expressed interest in developing further discussion and sharing their expertise.
Right. So what he's saying there is we had in the CBO quantitative survey, I'll call it that, for want of a better word. At the very end, there was a question that said, would you be willing to share more of your knowledge and speak more in depth with one of us here at the Long Island Health Collaborative? And that's where we got the interest from. And there were more who said yes than we were actually able to connect with and finally schedule an interview, but Michael explained that.
The purpose statement and research question. The purpose of this interview project was to identify key themes highlighting the most pressing health issues facing Long Island's populace. Key informants from a variety of community-based organizations were interviewed and asked to identify health and social barriers and how they could be overcome for the population served, and what are the predominant health issues and barriers affecting Long Islanders, Suffolk and Nassau County.
Right, so that's what we were looking to find out and go in more in depth of what they had to say.
Right, for the methodology, interview structure, grounded theory, participants provide accounts of firsthand experience with the subject inquired. The interview instrument provides a mixture of open-ended response and rigid selection to invite participants to respond within a focused structure. And researcher reviews the interview data collected, ideas and comments became apparent and consistent, and dominant themes begin to surface as continue to read through the transcripts. These themes are then tagged as codes, and additional collection review of data can group codes into higher level concepts and narrow the focus. Additional themes drawn from the Kaiser Family Foundation, social determinants of health, 6 domains, and the 5 New York State Prevention Agenda priorities also assisted.
Yeah, Michael, you want to just explain a little bit more of what grounded theory is?
It's basically the interview instrument invited open-ended responses, and you still kept the top discussion narrowly focused on the health system needs. And then continuous themes can be brought up, such as like chronic disease, financial insecurity were very common themes. And then these codes are then parsed through and related back to the interview transcripts. And then several concepts reappeared frequently under these codes.
Okay, so like grounded theory means kind of from the ground up, actually
Yes.
reading the interviews, the transcripts, and you as the researcher or me as, there's a little subjectivity there, I guess, right? But as you're reading through it, you're actually, the codes are growing themselves almost, right?
Yes.
From the ground up, they are emerging from the text, and that's how you come up with your main codes. And then there's subcodes, that words that might relate to, say, for instance, if economics is the code, because that's come up quite a number of times.
Yes.
But then when you see the word employment and job, you then say, yep, you code that under economics. I'll get that kind of subcodes under economics.
Yes.
Yeah, okay.
And here's the sampling procedure: purposeful sampling, sending out surveys to key informants from CBOs who have knowledge and experience with Long Island's healthcare landscape. 20 informants initially expressed interest in being interviewed and were contacted. Consistent outreach and follow-through yielded 12 informants to fully proceed to the final interview stage. And these interviews were conducted between February 23rd and March 4th this year.
Okay, yep.
And the data collection: participation was voluntary, response is confidential. Interview was conducted and recorded via Zoom with 2 interviewers. Audio recordings were transcribed and uploaded to Atlas TI for analysis only with interviewee permission. Transcripts were cross-examined between each other to observe similarities and differences. Common themes in all transcripts were identified and coded, with these codes derived via grounded theory as they were presenting themselves in the text. Codes were also informed by New York State's Prevention Agenda and the Kaiser Family Foundation, 6 determinants of social health. And information from the interviews was aggregated and a comprehensive report was produced. And here's the interview instrument.
Yes, it was purposely made short because we wanted to be respectful of the CBO leaders' time. And I would say,
Yes.
Brooke and I conducted all of the interviews. And I would say probably like 30 to 40 minutes tops from beginning to end was what it took, which seemed like a very reasonable amount of time to get good information from the interviewees. I just wanted to say one other thing. When we talk about transcripts, we're cross-examined between each other to observe similarities and differences. So that that doesn't relate to intercodal reliability, right? That would be me reading through and seeing what codes I come up with compared to you.
Yes.
Yes, which we did to an extent. So there is some level of intercodal reliability inherent in the report. Okay. Did you want to add to that, Michael, anything?
Just the intercodal reliability, our codes were very similar.
Yeah.
And I have yours was a great groundwork to move forward with.
Mm-hmm.
It was, those were essentially perfect. They came up very consistently through, I mean, all 12 interviews.
Yeah.
So that was good.
And then here's the codes, right? The main
Yes.
codes and then the subdomain codes.
Access, barriers to healthcare, chronic disease, culture, language, financial insecurity, education, environment, food insecurity, nutrition, inequality, disparities, and infrastructure, legislation, like federal level legislation, mental health and health services, programs and services, and the creation of them, substance abuse support groups, and women, infants, children were the dominant themes across all. And these are the four most prominent: mental health, financial insecurity, education, barriers to healthcare. And here's quotes from the transcripts, but again, confidential.
Mm-hmm. Yeah. You know, these, it's so telling when you read these verbatim quotes like this. It's particularly the financial security one. I mean, we probably don't need to hear this. We all know this, but it says it's not true that people can live on $15 an hour. How true is that, right? So when we think about that and we think about what people are able to afford, and perhaps maybe if they make $15 an hour, they need to work 2 jobs, maybe 3 jobs, and their health and all those good healthy behaviors that we want them to engage in kind of fall to the wayside because they really have no time for anything but to just earn some money to survive. So it is an absolute real problem, and you can see how these social determinants of health are actually at play when you look at a quote like that. Okay.
Here's the results. All participants talked about their roles and organizational objectives with enthusiasm. All participants provided their expertise regarding the social determinants of health most impacting Long Island. And all participants expressed what they would like to see improved by Long Island's social and healthcare landscape and additional goals moving forward.
Okay. So we have barriers healthcare as number 1 there. And when we talk about that, and I recall from the interviews, right, because I conducted half of them and jointly some of them as well. When we talk about barriers to healthcare, we're talking about problems with transportation, problems of affording or finding providers. Was that something that came up?
Yes.
Convenience of finding providers. And I think that harkens back to individuals who might not work a traditional workday or work a traditional workday 9 to 5. And then there isn't availability of health providers beyond that, like a primary care practice that might be open later and whatnot, although that's starting to change, I think, somewhat. So and then what about education? What was that? What was that seen as, that we have enough education? We need more educate. What was going on there?
More education to facilitate more of it, everything, K through 12, college, vocational training, and increased health and healthcare literacy, and better resources for health and healthcare literacy.
Okay. And the programs and services, what was a little bit behind that?
The creation of programs and services, they were encouraging like more funding for them. There was one that was taught food and food nutrition, like 6 weeks classes that like there's no like they're not turned down at the door, like no insurance needed, like free services to help like educate people on better like cooking practices, because food security was a big one, especially with what COVID was going on.
Right.
Like after these conducted, so everyone has that like shared experience at this point.
Yes. Okay.
And it's all getting more expensive as we speak.
Yes.
Essentially, like
Absolutely.
every day.
Every day, yes, the prices keep going up. I think I recall in one of the interviews, somebody lamenting that funding for these programs is kind of temporary. It's there for a short amount of time.
Yes.
And then it goes away. So that's very frustrating. So a program can be really working well, but then it's not funded again, and then poof, it goes away. So, and I'm preaching to the choir because we all know this. We face this all the time. So that's concern that the CBO leaders expressed. environment, what does it say? I'm right. Economics and financial, I think we talked about what that is. That's a lot to do with employment and meaningful and sustainable employment. And then inequality, does that say inequality? What does that say? I'm reading sideways. Inequality and disparities. Can you talk a little bit more about how that popped up in the transcripts?
Those of low income and uninsured have extraordinary difficulty getting services. And if they are uninsured, they're afraid of getting them. And they wanted to create programs that could help lessen hospital costs
Oh,
for people
okay.
who don't have a good health insurance.
Mm-hmm. So was there a feeling that perhaps maybe the structure of the health system itself needs some repair here?
Yes, like
Yeah.
at the federal level, like several of the interviews mentioned, it's at the very top, working its way down to the bottom. It's a for-profit healthcare system, which causes enormous problems. Like legislation, government, federal ties into that.
Mm-hmm. So for-profit being would be like help out in the community with private practice physicians, right? Because all the hospitals are not for profit, but
Yes.
perhaps what they're referring to is maybe finding a provider that's in their insurance network. Some of the networks are very narrow. As I said, some of them have very high deductibles, the plans, and then that leads to another issue of people not being able to, they have insurance, but it's like inferior insurance. Okay. All right. And then I see mental health is an absolute issue, and you have chronic disease is in there as well. Is there after, I can't see infrastructure. What was infrastructure about? Again, was that the design of the healthcare delivery system?
Yes. It's just about again, this also ties into barriers to healthcare, just difficulty accessing the healthcare, and low and no insurance, low income. It all essentially, it seems like economics is like the very root of it, just like increasing survival costs.
Well, that makes sense. Absolutely. Economics is at the root of it. Okay. Anything else? Well, I know we're going to open it up for discussion next, and let me see what the next slide says. Discussion experience. So this is your part, right? You know,
Yep.
what you learned. So tell us about what you learned.
Learn much about the interviewing process, along with the Long Island Health Collaborative's operations and goals. And after this, we're comfortable with the process of qualitative research and the grounded theory of qualitative research and data analysis, and way more informed about Long Island's healthcare and economic landscape. And learned about the Kaiser Foundation's social determinants of health.
Yeah, there are 6 domains, and the collaborative has embraced, because there are a number of different models for social determinants of health, but the collaborative for many years has embraced with its partners, the Kaiser Family Foundation social determinants of health. So that's why we keep referring to that particular, the Kaiser Family Foundation ones. All right, let me go back for a minute here. Does anyone, of course, you can ask any questions you'd like. Just take yourself off mute and ask any question you'd like of Michael or me or Brooke. We will be the slides will be available, and then we also have a written report that goes a little more in depth that everyone is going to get as soon as we put a few finishing touches on that. You'll have that in a couple of days. But I'd like to take the opportunity for anyone who would like to ask a question to do so now. Well, so that means you did a good job, Michael.
Thank you.
No questions. Yeah, it's, and I know my colleagues on the call, many of you have been involved in this kind of research, but I like the narrative, and I'm a storyteller. So when I sit down with someone, a community-based organization leader, first, I'm always amazed at the passion for what they're doing. That is very apparent every time I sit down and talk to them. But I do feel that you learn so much more than just what a number says. It's good to have the hard data, but it's so good and so helpful to wrap that data with a story around it. And that's what this qualitative analysis does for us. So it just gives us another dimension. Okay. Well, I want to say thank you and to Michael and Brooke. Brooke really was the one who worked very closely with Michael. Do you have anything you want to add?
I do just want to say thank you. And yeah, good job, Michael. We really appreciate this analysis, and it's another tool in our toolbox.
Thank you.
Yeah.
Thank you for having me.
Yeah. And we used Atlas TI. We used the web-based cloud version of it, which is, I guess, version 22. And so Brooke and I, we know about it. I don't feel that we're as conversant with it as Michael is, but we are getting there. Michael promises he's going to give us an educational lesson after this, later this week. But it's a really good skill to have, and it can be used for a variety of situations, if you just want to get the pulse on maybe a group of constituents you're working with or patients you're working with, it's a great tool to use. The web-based one, Michael has also used the desktop version. He said the web-based one was a little bit easier to use, so that's good to know. And it's quite inexpensive to get the lease per month. It's pretty cheap. So we're glad that we have this tool and that we've learned to use this tool, and we want to refine our skills, Brooke and I, in the use of this. And so that then if anyone from the collaborative turns to us and has a research idea, we'd certainly like to help work that through with you if we can possibly do that. So I'm just going to jump now. I had told you there were 2 closed-ended questions in the community-based organization qualitative interview survey instrument. And we just kind of really wanted a measure of what would be the predominant social determinant of health that the CBO leaders felt rose to the top, and the same with the priorities. And the CBO leaders, in terms of representation, we had mental health represented. We had, nutrition represented, nutrition services. Help me out here, Brooke. Who else did we have? I mean, we had quite a number of education, housing. We had quite a
maternal health.
We had quite a number of sectors represented as best we could. So we felt good about the data that would come out of this because of that representation, that broad representation we were able to secure. So you can see here that kind of in tied is the education and community and social context for the social determinants of health. And in priorities, prevent chronic disease, but prevent communicable diseases came in at number 2. And I think, what came in at number 2 first was prevent chronic disease
and promote well-being. They tied.
Promote well-being came in at 2. You know, when the blues mixed together, okay. So that confirms what we found with the individual community survey and squares well with that. So this is also available on our website. We did share this last time around. So I think that we were able to pull together pretty decent amount of primary research for everyone to draw from. Remember, we do have the Sparks hospitalization data still available for years 16, 17, and 18 on our site by a variety of diagnoses codes that you can look at that as well. Let's see. And this talks about the actual, like the hard data analysis, I guess, the quantitative, where there were 45 total responses. That analysis is complete. We shared that last time around, and that is also on our website. So let me go to that and see if I can see where we have that. You have that toward the top, I think.
It is toward the top of that page, yes.
Community-based organization. And we released that survey between December 1st, 2021 and January 15th, 2022. And there were a total of 44 surveys collected, or 45 collected, 25 for Suffolk County, 10 for Nassau County, and 9 with no specific location. If that adds up to 45, I guess it does. So let's take a look at, see if I can get this shared here. We'll just take a quick look at it. Hold on. Okay. So here we are. Oops, sorry. We'll do it again. Yikes. Okay. So what we have here is, let me just figure. So this is for the community-based. Is this the community-based one, or am I looking at, which one am I looking at?
I think you're looking at the community member
This is
survey.
the member one. This is the CHAS survey.
Yeah,
So we talked about that, and we see mental health. Okay, so this is just the summary report of what I showed you before in the pivot table. So let's get rid of that. We don't need that. That's not what we want.
I'm sorry. I think that was what you wanted. I'm sorry.
Oh, I got rid of the one I did
I
want?
think you were correct. I think it was the,
Oh, okay,
The
well, we'll
CBO.
try again. Okay. Community member survey. So is this the CBO one?
it is. I think that terminology is just a little bit misleading.
Oh, so it should say CBO member survey.
Yes.
findings. Okay, all right. So, so we put it into, this is the quantitative survey. This is the quantitative analysis that we sent out. It is not in, I don't have it in the pivot table format, because I did not have the funding to underwrite that, to do that, because we had never done a CBO survey like this before. So what we were able to do was at least give, for each question, a response in the top 5. And so that's available for you to use as well. Okay, we'll get rid of that. Along with all those other data resources I talked about. And I think is that it? I think that's it. So, the next, is it it? It's not going to anything else. I think it is it. Is that my last slide, Brooke?
I think there's a discussion slide.
Yeah, but it's not going. Well, there's a discussion slide. We can have a discussion if you'd like.
Yes.
The end of June, my plan is to provide a template community health needs assessment report for the region for hospitals and counties. You can use parts of it, you can use all of it, you can use none of it. And it's just to help you, trying to take the burden off of you to an extent. And that should be ready toward the end of June is my target on that. And I've done that in the past. So it'll follow pretty much the same format. It follows the state guidelines, right? So the state has sent out guidelines of the sections they want covered, and it follows that exactly. It's not, I'll pull in some charts and bar graphs and pie charts and whatever makes sense in different sections of the report. And as I said, you can add to that, and I will have notation in the margin as to where you could add, certainly talk a little bit more in depth about your particular programs and interventions and particular partners that you might work with. And I'll note that all in the margin column and make it as easy as possible for you to complete this. Anybody else have any other questions? I don't believe that no one has a question. I can't believe it. Can't be so. Oh, there we go. Ah, it went, okay. And that's what I just said, the template's coming in June, you know, the China's due the end of December. And here we are with our questions and comments. Nobody has any questions, concerns?
I have a question about the spreadsheets that we got last time for the results of the CHNA. I don't know if it's just me and my computer, but I tried my computer here and at work, and I was not able to like do any of the in-depth kind of analyses because it's like from an outside source and there's some kind of block on it. So I don't know if it's programmed into the spreadsheet or if anybody else had a similar problem, but I recall having the same problem when I was at the health department.
So you're talking now, what are you talking about the CHAS, the ones where it's zip code based and you want to pull out and?
Yeah, the community health needs assessment. Yeah, the spreadsheet that had like all the
Right.
different,
Let me
you had a
think.
consultant presented at the last meeting.
Oh, yes.
Did anyone else have a similar issue with it?
You shouldn't have an issue with that. You sure you're clicking enable editing at the top, right?
Yes, yeah, it's not that. So
Yeah,
I can see what's on there, like what you're showing.
yeah.
But if I click on, you know, some of the filters that you have,
It wasn't working?
it doesn't work. It blocks it and it says this is from an outside source and you're not allowed to use this. So it's not really that helpful.
That
Has
may
anybody
be,
else come across that?
It's working for me, I think. You're talking about when you click on like the income level and then,
Yeah, like if
Well,
I want
yeah.
to look at a specific, you know, a specific zip code or something.
I can click on like income and it'll filter that out. That's working, but I don't know about doing a specific zip code. I don't know.
Yeah, I don't know that it's set up to filter for zip code.
Well, I mean, maybe not that, but when I went to look at it, it was not, I was not able to use it. Let me see if I can open it up.
that notification makes me think it could be an internal security, you know, function that's blocking you, but I'm not sure.
Yeah, so if I want to filter, say for female who earn that amount of money, and I just want to look at Nassau, this is what it's going to give me. But this, it's not, so that's not working for you, those filter functions.
No,
Okay, so Linda, it is Linda, right?
yes,
Yes.
sorry.
So Linda, I will set up a call with you and the data analyst who did this for us to see what the issue might be for you.
Okay. Yeah, I'm trying to see if I can.
Yeah, now, no, so Asha, you didn't have troubles, you were able to use the filters and,
Yeah, so it
Yeah.
says
Okay.
initialization of the data source failed. Check the database server or contact your database administrator. Make sure the external database is available and then try the operation again. If you see this message again, create a new data source to connect to the database. So there's something that's just not working on it.
I don't know if that's Stony Brook that has an internal, something internal in there that's not
This
letting that
is not
through.
my home computer. I'm
Oh, your home
working from home
computer.
today. Home computer, but when I used it on the Stony Brook computer, it had the same.
All right, so then I have to, I can't answer that question. I don't know why you'd be having that troubles. I mean, I'm using it here, so I'm, you know, I went to the website, I downloaded the Excel sheet and I was able to maneuver. So I will have to have a conversation offline with you and the
Okay,
data analyst.
thank you. Sorry to hold you up.
That's all right. Is there anybody else who, you know, because if this is a widespread problem, I would like to know because I want to correct it. Is anybody else gone in and, well, Asta, you have used it and you haven't had troubles. Anybody else on the call had troubles or have gone in and used it? I guess everybody's used it. No? All right, so we'll check it out for you, Linda. And,
I can try, I mean, I'll try like re-downloading it and see if that works, but
yeah, no, you know, don't drive yourself crazy. I'll connect with you in the next couple of days, you know, within the next couple of days, we'll get something set up.
I can send you a screenshot of what it looks like.
Okay, yeah, do that, and then we'll figure it out.
Okay, thank you.
So if there aren't any more questions, I guess we can close the meeting. Again, thanks to Michael Pape, Stony Brook MPH student, for working through this qualitative analysis with us. We appreciate the assistance, and we appreciate everyone being on the call today. We're hoping to make this as smooth a process as we possibly can for the counties and the hospitals. And of course, we're always here to answer questions, anything that you need. I guess that's it, right? I feel like I can't believe we're done, but this work group is not going to meet again. Oh, Dr. Piggott, we need a song for that. Did he leave? Is he still there?
I'm still here. I don't want to do that virtually though. We'll have to have an in-person thing. And,
Okay.
yeah.
The saxophone.
Okay. So long. Goodbye. Lovely to know you. Whatever. Okay. So again, we're here. We're available. Call us. Just because we're not going to have any more formal meetings doesn't mean you can't call us. And you know, as we work through this. But I thank everyone again. Thank you so much.
And
Thank
thanks
you.
to you
Thank
guys.
you.
Great work. Thank you.
Bye.
Bye.
Thank you.
Thank you.
Bye.